Welcome back to Outside the Beltway. I'm John Ferks, and I am your blowtorch for free speech in America. You know, when you think about free speech, and you think about a blowtorch, and you think about telling the truth, and you think about the words, one of my favorite sayings, it's really from the Bible, right? The truth will set you free. I kind of live by that. And I've had a lot of issues in my life, as many of our fans know. Don't want to get into it on a Friday. Been there, done that. But the truth, my friends, gets you out of bondage in so many ways. And Dr. Peter McCullough is joining us now. I've had Dr. McCullough on my show since the advent of COVID. And everything Dr. McCullough has said, going against the mainstream, the government, the so-called authorities, the CDC, the liars, the cheats, the frauds, everything he has said is right. Everything that people call the conspiracy theory is right. The guy's batting like 1,000. There's not a single thing, and he's been abused, sued, banned, shunned, and yet he's still here. Our beacon of the truth in medicine. Dr. McCullough, thank you for joining us.
Thanks for having me. Batting 1,000. I'm in the right place. Our Texas Rangers parade is today, John.
Well, you're talking to a lifelong Houston Astro fan. So whatever. Have your one parade in the history of your team. Have your parade. Be done with it. And next year, we're going to kick your ass again. Now, having said that, let's get baseball out of the I don't watch a single pitch of that World Series. I was so mad that they beat my team. But you know what? It is what it is. You're having the parade. I'm not. So I get it. So and you did tell me on an earlier show the Rangers were going to win the World Series months ago. So yes, you are batting 1,000. But Dr. McCullough, just give us an update. Some of the recent things that you've exposed. Give us like the top 2 or 3. And then I want to get into a little bit about your company and how important that is to everyday Americans.
Well, I think one of the top line news stories is really good news for America. We are rounding the curve on a fairly minor fall outbreak of COVID-19. It was led by EG5, FL 1.5, and then HV. Those were the substrains of Omicron. Very mild. Didn't experience any serious cases in my office, easily treated with the virucidal nasal sprays and gargles. Didn't really have to reach for prescription medications. And now, all the indicators show us that things are on the way down. So Americans don't have any worry coming into the holiday season. COVID is, in a sense, grinding out. The final outbreak, and this could be it, was very diverse. It didn't have a hyper-dominant strain. The vaccines were completely irrelevant since they were targeted towards XBB 1.5. As of October 4th, there was only 1.3% of Americans who have taken the boosters. Multiple states are outlining mandates for any type of vaccines. College mandates are down to a very small number. So we're past that. The other big update, though, is that we're seeing a disturbing continued trend of cardiac arrests in people who have taken the vaccine. Now we have data from Nakahara in a human cardiac PET study showing that positron emission tomography scans of the heart change in almost everybody who took the shot, at least for 6 months or longer, where the heart's metabolism changes. This is a bit disturbing. We don't know if the implications of it are. Crossan from Harvard has showed messenger RNA stuck in the heart now in people that have died. And then finally, Schreckener from Germany has shown that the Pfizer and Moderna are directly toxic to heart muscle cells. So we have a lot of information suggesting these are no good for the heart. They should be off the market completely.
Yet, Dr. McCullough, just a week ago, we had the health minister of Canada advocating for another vaccine, same kind, same strain, for infants 6 months and older, and demanding that everybody in Canada have this when they've got access to the same information that you have. So you look at this, you know they've got this information, yet they're pushing it anyway. And Canada's always the beta case for what Biden does. They're pushing it anyway on infants, which is absolutely insane. Is this just a plot here for government authorities to take over the entire healthcare system? I mean, what is driving what Canada did, having the information that you just outlined?
It does look like it's a worldwide plot. Every single country is still recommending these vaccines. None of them have actually taken them off the market. They're completely unsafe and ineffective. I can't recommend them or have my patients take them in practice, but not a single government will back down. I even had a call with the NBA recently, and just some advice, and they said, listen, we never mandated it. I said, well, why don't you stop recommending it? But no one will even stop recommending it. They feel as if this worldwide cabal, this vaccine syndicate, what we call the biopharmaceutical complex, is so powerful and influences life in so many different aspects that people feel absolutely afraid to just step up and say, drop these vaccines.
Vaccine syndicate, it's a cabal, there's no question. It's about controlling your health care. That's why they want to control the food supply, your health care, that's why they have digital currency. Now, I want to get to your company, which the wellness company that you guys have created. One of the key things with this is you've got a medical kit. I've got 3 of them, and I can give you my reasons for that. But why do you believe right now, with what the government is involved in, getting one of your medical emergency kits is so critical for a family?
If we've learned anything in the pandemic, John, it's about early treatment. I mean, immediately when people start having symptoms, we're told by everybody that there's going to be another pandemic. It may be another virus very similar to COVID that's released from the lab. We found that generic available medicines are safe and effective. They work against multiple organisms. Secondary pneumonias, for instance, can certainly occur and complicate things. So why not have patients visit with a doctor, get an emergency kit, and be prepared? And that's exactly what we've done. They're very popular. I don't think Americans are going to get burned with the next pandemic. They're going to be ready with a wellness company medical kits.
Well, the thing I like about the medical kit is you have a guidebook there that tells you everything, so it's very easy to follow. But the other thing is you've got the medicines in there. Obviously, you have to do the doctor consultation online. It took me about 10 minutes, but and then you get it. But the key to this thing is you're getting ivermectin, you're getting the Z-Pack, you're getting a bunch of different antibacterials, antivirals with everything there outlined. Now, let me ask you this. Outside of the COVID, what are some of the common things that can happen to a person where these medical emergency kits are going to come into immediate play?
Well, there are common forms of community-acquired pneumonia, pneumococcus, mycoplasma, and others. That's covered with the antibiotics that are provided. So somebody at risk who develops the characteristic signs and symptoms of pneumonia, they're going to avoid an urgent care visit or emergency room visit or hospitalization for that matter. The same is true for strep throat, as well as common forms of skin infections like cellulitis. So people can really cover their bases. Nowadays people are very sophisticated, John. We're given some instructions and reasonable guidance, and somebody on the other end of the phone, if need be, we can head things off at the pass and really cut down, I think, this urgent care and emergency room traffic.
Well, the other thing you have to look at is, remember last time ivermectin was proven to be a very effective therapeutic, yet the government banned it. You couldn't get it. Doctors couldn't prescribe it. But now you can get that with the medical kit. I mean, what are the chances if there's another outbreak, even if it's moderate, that therapeutics like that get banned again? Because really the reason they banned them is because they didn't want it to go away. They wanted it to spread. They wanted people to be afraid so that they could get, mail out ballots and say you can't choose between dying and voting, which was basically the whole reason they did this, in my opinion, my judgment. So could they ban this again?
They could. They could try to certainly restrict access. We saw before that when this biopharmaceutical complex flexes its muscle, boy, the medical boards and pharmacy boards really carry out their orders. So the pharmacies weren't dispensing the medicines even when there's a lawful prescription to give one. So people started to really become alarmed. And it wasn't just hydroxychloroquine and ivermectin. It included colchicine, budesonide, prednisone, the drugs that we really, rely on for so many different aspects of care. So people have lost trust in the big box pharmacies. Community pharmacies were different. They've pulled through for us. And now we've got the wellness company provide coverage really all over the country.
Well, listen, what you guys are doing, this gets us out of the vac syndicate, out of the government-controlled medical suppliers. This is why I love these medical kits and I love the wellness company. As I said, I got 3 of them: home, office, RV. Now, let me just ask you something. People get this; they're gonna be able to follow it, and they get outside of the system, which is the beauty of what you're doing. Here's all you have to do, folks. Go to twc.health/Godzilla, twc.health/Godzilla today, and order it. That's twc.health/Godzilla. Use promo code Godzilla. You're going to get 10% off. You should get 1 or 2 of these, depending on where your family is. This gets you immediate access to the things that you need in case of an emergency and gets you outside of the rat race system where the government is trying to control your health. Dr. McCullough, your founding of the wellness company is very visionary. It's catching on. And I want to thank you for all you've been up against. I mean, all you've had to do and all you've faced, but through it all, you have never wavered. And I tell you, Doc, even though you're a Texas Rangers fan, I still love you. Dr. Peter McCullough. I can't get over that. twc.health/Godzilla.